the number of people infected will continue to increase. It is a function of mathematics.
New concerns that the coronavirus will continue to spread as the death toll rises. Now Philadelphia is investigating another possible case of the illness. This is Eyewitness News at 6, streaming on CBSN Philly. Good evening, everyone. I'm Yuki Washington.
And I'm Natasha Brown. Jessica's off today. One patient in Philadelphia just tested negative for coronavirus, but now another case is under investigation.
There have also been new deaths from the coronavirus in both Washington and California. So far, it has killed 11 people in the U.S. New York State is now reporting 11 cases of the virus. Meanwhile, the House has passed a bipartisan $8.3 billion funding measure to battle the virus. The Senate is expected to vote on it tomorrow.
And fears of coronavirus have certainly prompted businesses and schools all around the country and the region to cancel events, even temporarily close.
Health reporter Stephanie Stahl is here now with the latest.
That's right. We've got some new information for you. The Philadelphia Health Department says the potential case that was pending from last night has come back negative, but they have another possible case that's now being tested at the state lab.
This is the first look inside the Pennsylvania Department of Health's newly activated Emergency Operations Center that allows for enhanced response coordination to deal with coronavirus.
We are prepared for it. We may not be able to totally prevent its spread, but we can mitigate its spread.
Philadelphia Health Commissioner Dr. Thomas Farley says keeping sick people away from others is a critical part of containing coronavirus, which appears to be easily spread by people coughing or sneezing.
So generally it's transmitted in close contact, people within a few feet of each other. The people at most at risk would be healthcare workers who are caring for someone who's sick, or household members, people who live with someone who's sick.
Sick people are being advised to stay home. If symptoms that are flu-like get severe, call a doctor instead of going to a hospital.
I think it's the unpredictability that's the challenge.
Still, hospitals around the region are ready for a potential influx of patients.
We, Jefferson, and surely most hospitals, and perhaps hopefully all hospitals, are preparing themselves for the possibility of an onslaught of what could be an epidemic of this infection in the United States.
Now, coronavirus is most dangerous to the elderly and people who are already sick. That's who would most likely need to be hospitalized for treatment. But we currently, again, have no confirmed cases in the Philadelphia region, not in Pennsylvania, New Jersey, or Delaware.
Okay, keep us updated. Thank you, Stephanie.